Ms. Gomba, good morning. Thank you very much for your time. MEC, just to clarify, just give us your latest numbers in terms of the people who have tested positive in your province.
The latest number that we have officially is 19, though I hear you speaking about 21, which then suggests that in terms of further synthesizing the numbers, we might be having 2 that's still outstanding, that side. And until the minister pronounces on that, then we're able to actually confirm those numbers, precisely on the basis that they are not tested here. They come from the ICT center. Secondly, as to what is it that we are able to do as the province, or what is it that we are doing, we have been following contacts and starting to create perimeters where they stay, where we're able to actually test not just the people that were given, but a sample in the area to see how far maybe the COVID-19 has spread. On the other side, as the minister has pronounced, that now we must actually go kind of full-blown into areas. We have set up areas that were starting on Monday, which then are going to go to all the districts that we have, in particular where we've had cases. So we're attacking 6 districts as from Monday up to Friday and see what happens, change if we have to change, but also intensify in certain areas if we have to intensify. The ability for us to be able to do that has been enhanced with the opening of the lab here in Port Elizabeth, and equally us being given some vans that are going to be able for us to actually collect specimens and actually deal with screening on site.
Are you satisfied that the capacity of the lab that's been opened in Port Elizabeth will be enough and sufficient for what you need to do over the next few days and weeks?
I would not want to say it is not, precisely because it improves what we currently, we're operating on, having to take samples this side and send them to Johannesburg. It improves it, and even the time that we're actually going to take now does give hope that we shall be able to immediately pass tests and bring tests. For instance, we gave a specimen on Thursday, very late on Thursday, but we were able to get those results by midday on Friday, which to us tells that at least the volume and capacity is going to be improved.
We understand from the 19 that you are saying officially that's what's on your register of positive COVID-19 cases in your province. We understand that one of them is a nurse who may have come into contact with other people at a funeral. Are you currently busy with tracing those who may have come into contact with this nurse?
We have not only that nurse from that funeral. We've got 2. One is a retired nurse, and one is a nurse which is currently in the employ. We have actually gone on to talk about their contacts. What has come back to us is the fact that they attended a funeral in Port Elizabeth, and the funeral was full. And that then were assisted by the should I say, the head of the Methodist Church in Port Elizabeth, who actually, the superintendent, that's the word I was looking for, was assisted by the superintendent of the Methodist in PE, who has written out a notice to indicate to them that out of this funeral, we've got a case, because they were thinking 1 case, but those who feel they've got symptoms must please actually avail themselves. We've had an influx of people who went to that funeral who are wanting to be tested. We've screened a lot of them, and we've since cleared majority of them. We have not found a case yet beyond them except the 2.
Okay. Are you concerned, though, MEC, that that funeral, from what you've said, may have been attended by more than the regulated 50 people, and that people don't seem to be respecting the regulations? And what are you planning to do about that?
This funeral happened before the close down was announced. It happened some 2 weeks back, before the close down was announced. However, at the time it happened, it was a funeral for 100 people. We are also aware that the church did not observe the 100 number. They were so many. The church was full, as we were told, and some people were outside. So for us, that's a concern that we say 100 and churches themselves could not be able to control. They rely mostly that police should come. Even if they needed police to help, nobody called police.
Okay, thank you very much, MEC for Health in the province of the Eastern Cape, Cindy Swakomba, raising a concern there that in one particular incident where there was a funeral, when the regulations were indicating 100 people, a funeral took place with more than 100 people, and the province is currently looking into this matter.